you for both your permissions to use this video for educational purpose and on internet.
Sure.
Yes.
Okay, so tell me first about your symptoms before the surgery.
I had lots of pain.
1 to
Yeah.
10, how bad?
There was days that it would get up to that 8, 9, 10.
Okay.
So, I'd get shooting pains.
How long?
Pretty, not super long. I mean, they'd be pretty quick.
Mhm.
But
But
there was a
how
couple
many
times it
months
would-
or years before the surgery did you have those symptoms?
At least a good year.
Good year. And how was your daily activity, like walking and taking care of your daily?
It took a lot of
businesses?
effort.
A lot of effort.
Yep.
And that is normal for the problem you had. You had a 2 levels severe disc disease, some stenosis, and as well as material of the disc was pushing on the nerves that going down the legs. We call it radiculopathy. Now the surgery was just less than actually a day ago. It was yesterday afternoon.
Yep.
And here's your physical therapist. And tell us, how was the physical therapy session this morning?
She did excellent. She's rating her pain a 2-3 out of 10. And I didn't have to help her get in or out of bed, and she did 6 steps with handrail.
So even
no
steps,
problem.
even stairs.
Yes. Yep.
So by your assessment, is she clear to be
She
discharged?
is clear to go.
Today, a bit less than about actually 15 hours before after the surgery. So
Yep.
do you feel ready to go home?
Yeah, I think so.
How's your pain?
It's not bad.
Okay.
Yeah, it's-
So you just got back to the bed, right? So I
Yep.
just want you to lay down and relax. But
Yeah, I was sitting in the chair and I was out walking.
do
And
you have any sharp pain going down the legs?
nope.
Did
Had
you?
a little bit yesterday,
Mm-hmm.
but it would be real quick and then it was gone.
Yeah.
And
Before the surgery, did you have sharp pain going down the legs?
once in a while I'd get it on the left
Yeah,
side.
okay.
And then
So-
I had some of that numbness and tingling on the left side, even into my hands. and-
Okay, and this is practically very good result for a 2-level fusion that you got yesterday, and our surgery was just 50 minutes. We didn't spend much time on there because we didn't have to destroy lots of muscle, and those muscles are that you have to deal with after the surgery. Usually after open surgery, we cut all the muscle, literally disconnect them from their origin, and then we send the patient back to you, and you have nothing to work with.
Exactly.
Whereas in this method, patient, we don't cut the muscles from their origin, so you have something to work with.
Yeah.
So generally, our patients do much better with physical therapy because exactly of that reason. Can you compare from in your experience, open version, minimal invasive, how different they are in your experience?
With her case, yeah, it goes a lot better. Like you say, we're not cutting into the muscles, so we're saving on that strength and compared to where you have to go real invasive.
Yeah. No, there are studies that show, whereas our patient, 96% ambulate within the first 24 hours. After open surgery, only a small fraction, less than 10%, ambulate in the first 2 days freely. So meaning that, our studies show actually, we flip the numbers. Instead of just less than 10% ambulating within the first 2 days, our patient ambulate over 90% in the first day or so. Is that as well reflect your experience, whereas you have been working here for a long time?
I have for 24 years.
Yeah, so you have seen, when we were doing open surgery here, you have seen many of them.
That take longer.
Yeah,
Yes.
they don't usually go home 1 day after the surgery.
No, it's usually day 2, if not 3, depending on their age as well.
Yeah, and as that is for ambulation. Yeah, day 2 or 3
Exactly.
for even going home, even sometimes longer. I remember my own patient used to stay 4 or 5 days in the
Okay.
hospital because they needed time to ambulate. Well, thank you so much for the interview. I appreciate it.